Ready to go, Chair?
Okay, thank you. How is everyone this evening? I'd like to start the meeting, call it to order, and have the Pledge of Allegiance. Could I have Yvonne Wolf please lead us in the Pledge of Allegiance? Yvonne? If not, maybe not. Patrick, Commissioner
Sure.
Shannon, can you lead us?
Chair Davis, I think your cat was chiming in, but I'll go ahead anyway.
She's unhappy about something. I can't do anything about her unless I lead.
I pledge allegiance to the flag of the United States of America and for the republic for which she stands, one nation, under Goddess, indivisible, for liberty and justice for some.
Sorry about that. And Jenny, may I have a roll call, please?
Good evening, everyone. Commissioner Byers?
Present.
Commissioner Darvish?
Present.
Commissioner Freiberg will be about 15 minutes late. Commissioner Meltzer?
Present.
Commissioner Shandrick?
Present.
Vice Chair Palmieri?
Here.
Chair Davis?
Here.
We have a quorum. Thank you.
Okay. So what I would need is a motion to approve the agenda for this evening.
I'll
And
make the motion.
Adam moved and Barbara seconded.
Second. Okay.
Jenny, may we have a roll call for this, please?
Of course. Commissioner Byers?
Yes.
Commissioner Darvish?
Aye.
Commissioner Meltzer?
Yes.
Commissioner Shandrick?
Yes.
Vice Chair Palmieri?
Yes.
Chair Davis?
Aye.
Thank you.
Thank you all. Now we'll move along to the approval of the minutes of last meeting. I would need a motion and a second, please.
I'll move to adopt the minutes from the July 13th meeting.
Second.
Second.
It's been moved and seconded to approve the minutes as they are represented in our packet from July 13th, 2021. And I guess I need another roll call.
Of course. Commissioner Byers?
Yes.
Commissioner Darvish?
Yes.
Commissioner Meltzer?
Yes.
Commissioner Shandrick?
Yes.
Vice Chair Palmieri?
Yes.
Chair Davis?
Yes.
Thank you.
Cool. All right. So we'll move on to public comment. Jenny, do we have any public comment?
We currently have one person with his hand raised. Dean, do you have a public comment?
I do. I'm Dean Ambrosini. I just wanted to, first, good evening, everyone. I just wanted to take an opportunity. I've been coming to meetings for the last couple of months. I am with the Institute for Public Strategies, the West Hollywood Project, and I've taken over for Alexis Sanchez, who's moved on to another position. And I just wanted to take a moment to get acquainted with the commission and just let you know that we are continuing our work in the West Hollywood community to combat meth-related harms as well as alcohol and other drugs. We're currently working on a fentanyl campaign. For those of you who don't know, August 31st is International Overdose Awareness Day, and we will be launching a video series related to proper disposal of prescription drugs, as well as our Strategies or Solutions video campaign as well through our media outreach team. And as I said, I just wanted to take an opportunity to introduce myself to the commission, and thank you.
Excellent. Thank you. Now, Jenny, will be all.
Chair, let me ask if the public has any additional comments. Is there anybody in the room that would like to make a public comment? Please turn on your camera and your microphone, and we have 3 minutes. Is there anybody in the room? Chair, it looks like we can move forward. Thank you so
Okay.
much.
So we're moving, there is no consent calendar, so we'll move to unfinished business, which is A, Trans Can Work report to the commission, their third time doing so.
I can start this off, Chair.
All right, please.
Okay, of course. Good evening, commissioners. So I'm going to give a brief intro and then pass it over to Jovan, who will give the full update to the commission. So city staff completed a program audit of Trans Can Work on August 2nd. We reviewed data reported from the second quarter program report, as well as unreported data that was recovered from the first quarter. The data from the first quarter was unreported because there was confusion about the intake service category. Program staff mistakenly thought that they could only report intakes that resulted in the client returning for services, and they didn't count the clients who dropped out after completing one intake. So we agreed to review the data, and we verified 7 additional people who received an intake in Q1. The data that was submitted for Q2 was complete. There was only a few discrepancy, and so far the program is on target to meet their goals at the end of Q4. Trans Can Work is strengthening their relationship with JVS by holding office hours at their West Hollywood office and collaborating on diversity and inclusion training series to local businesses. In Q4, they've trained the Abbey, Chica's Tacos, JVS SoCal, H-Wood Group, Griddle, Planned Parenthood, Red Studios, and Rivera Financial Mortgage, Beverly Hills. Because of these efforts, Trans Can Work saw a 47% increase in the third quarter in their overall training numbers. So Jovan Wolf, who's the Director of Workforce Development, will be presenting on their update, and I'm also going to be sharing their PowerPoint. 1 second. That's good. Can everybody see it? Yes. Okay. All right. Jovan?
Awesome. Thank you, Derek, for that lovely intro, and a shout out to our team here. And yeah, so here's our slides. So I'd love to give you all the updates that have been going on here at Trans Can Work. So we can go to the next slide, Derek. So what we have here is our overall numbers for Q1 through Q4 up to date as of today. As Derek mentioned, we had our Q2 audit. So I have reflected all the new audit revisions here, including the 7 intakes that were not accounted for in Q1. So I'll just kind of go down the list here and show where we're at and where we're positioned to hit our deliverables by the end of this contract. So outreach contacts to prospective, I say that word wrong, prospective clients. Our annual goal is 52, and as it stands today, we have done 110. Outreach contacts to employers, we report actual, and we have done 61. Our new intakes that are unduplicated with affidavits, actually our annual goal is 20, and we have hit 18. So those need to be flipped right there. But we've hit 18. We've already done 2 in Q4. So we feel very confident that we will hit our 20 number, as far as probably exceed that. And our job seeker number of workshops provided, we have 16 as our goal. We've done 11. We also feel that we will easily hit that number. We are in collaboration with Gender Justice Los Angeles, and we have a workshop series that is starting this weekend with already 35 plus signups. And we will be identifying who is WeHo through intakes and affidavits through that list. And then we have our number of hiring events. We are at 0 right now, but we do have our virtual career fair coming up in partnership with HRC. That's located here. It's going to be located here in Los Angeles, that we're doing in September. And then our hires, our placements, we report actual, and we have 5 already. And Clients enrolled in training, our annual goal is 4. We've already enrolled 6. And employers train, our annual goal is 60. And we are at 54 right now. And as of Q4, we have already done 4. And as you can see, with the previous quarters, our numbers are pretty high with our diversity, equity, and inclusion training. So we feel very confident that we will hit that number of 60 and then some. So next slide, Derek. So I just wanted to mention some successes. I said some of these last meeting, but I'll just say for the most recent quarters, successes and challenges for Q3 and Q4. So for Q3, as I've said before, we did hire a wonderful WeHo employment navigator with lived experience, which we have found has been super beneficial with connecting with our clients who are high barrier here in West Hollywood. And, she's working one-on-one with them. And we have our partnership with JBS that's going off great. Our new navigator is there every Friday. And we have our training programs with AB 1111, as well as JBS's WeHo Works programs. And we have already referred some clients to the WeHo Works training programs for Q3 and actually Q4. And so there was a Warner Media Pathways program. So Warner Media, we did a training with them, a DE&I training with them, which opened up a Pathways program to employment. And we were able to successfully refer 3 of our WeHo clients to that program. And, within this quarter, we also hired a new data associate to help manage our WeHo clients and as well as our overall, clients. And we got our green light for a new technology, for a new jobs board and workforce management tool. And as I said, we are in collaboration with Gender Justice Los Angeles, and we have our first training coming up this Saturday. And as Derek had mentioned, since Sydney has been, has been now our training and education manager, where we're able to increase our D&I trainings by 47%. So that's a huge success for us. And then some notable challenges for Q3. Since we had to hire a new data associate and employment navigator, we had to do some intensive training. So that took some time. We were having many meetings with many software companies to figure out which technology we would go with. So, it took us a couple months to really figure that out. And with the new leadership, we had to fully understand what our grant deliverables were and, what the expectations were for WeHo. And we came together as a team. It was a challenge and a success in one. And, and during this time period, we were doing an extensive interview process to find the right navigator for WeHo. And then for Q4, here we are today. We successfully referred 2 WeHo clients to the JBS WeHo Works training programs. We are implementing our new workforce management tool and innovative jobs board. So we're actually in the works of doing that. I already said this. We have our workshop series coming up this weekend, which will also be rolled out for September as well. So this workshop series will pretty much build the client's skills to become moderators and panelists in the community, as well as for our DE&I trainings within Trans Can Work. And these are paid positions. And as Derek mentioned, we were able to count 7 intakes that had signed affidavits that were not counted during Q1. And good news, we're relocating to a new office space that will be housed with other TGI organizations. And this will enhance our collaborations, as well as we're super excited to, be able to do in-person services with our clients. We do in-person services at JVS, as well as the Trans Wellness Center, but now we'll be able to do it with our new offices. And let's see, we've met some of our deliverables. So I just want to say that's a huge success. And we are on track and positioned to meet all of our deliverables by the end of the contract term. So some notable challenges in Q4 so far. We're working as a team on the feedback received from the Q2 audit. So we are in talks with Derek, and whatever revisions that we need to make to all the reports, we will make that happen. And one thing I wanted to mention here, there has been some safety concerns around street outreach due to the political climate against TGI folks and COVID in general. And we have been talking about the need for training, some intensive safety training for our navigators, especially, our navigator is a trans femme, and there's, even more concerns as a, as a femme on the streets. So what we plan to do with this is we've already had a meeting with Luna. We want to reach out again and talk about a training protocol that's really centered around safety. And then another challenge here, due to the COVID variants that are coming out, a lot of businesses are doing this hybrid model, figuring out if they're going to stay virtual, go virtual, in person / virtual. And, we're just aligning with the employers while they're in this deciding, time and figuring out, will we be doing more in person, pivoting to in person, D&I trainings, keep it virtual, also with recruitment as well. One of our partners that we talked with, they are happy to do virtual positions, remote positions, but they want their employees to live close by just in case. So these are things that we are working out with some of our partners and employers. So that's pretty much it. But as a whole, I just want to say, we're as a team, we're overall very confident that we will hit our deliverables, and we'll just continue as a team and doing the great work that we do. But thank you so much for having us here. And if you have any questions, happy to answer for you.
Thank you. Do I have any questions? Commissioner Darvish?
Yeah, I just had a question about the navigator that you mentioned about their experience, just working with the population, their life experience. So the navigator was not in place before. Is it something new, or you had it before and you had to rehire or fill the position?
Great question. So our previous navigator was Sydney Rogers, who is now promoted to our education and training manager. So when that happened, we did an extensive interview process for the right fit for our new navigator.
Yeah. And your staff are within an office. You mentioned that you have a new office space. I didn't think you would be working at an office. I guess their cubicles are set. They're able to distance from each other and work.
Yeah, the new offices will allow us to have that kind of distancing. Our office, as it stands right now, is too small to do that.
Thank you, Commissioner Darvish. Is there any other commissioner that would have a question? Commissioner Meltzer?
Hi, thank you. Good work. That was a really good report. Thank you. Thank you. It's good to hear that good news. Just a quick question. When you said 7 intakes with a signed affidavit, what is the signed affidavit for?
I'm sorry, not a signed affidavit, signed affidavits. So the affidavits,
right.
Yeah, oh, sorry, I thought I heard a signed. No. So when we do an intake process here at Transcan Work, everything is verbal, right? So they tell us if they're homeless, they're couch surfing, they're doing gig works. They give us an address, they give us a cross street. We have them sign an affidavit to just give that extra, verification that this is true statements from them.
Okay, great. Thank you.
You're welcome.
Any other commissioners?
I'm sorry to interrupt. This is your secretary. Commissioner Freiberg is in the room. Thank you for joining us.
Okay. Sorry, I'm late.
Thank you. Good evening. Commissioner Byers?
No, sorry, I was just waving at Commissioner
I'm sorry, I got the wrong box. Commissioner Palmieri, Vice Chair.
Hi, Jovan. I just want to let you know, I think this report was great, and I think that your successes are great. It seems to be going along very well, and it makes me really happy. I think that you have tried really hard and followed a lot of of input from staff and from commissioners, and I'm really proud to see what you've been able to accomplish. I look forward to your future.
Thank you so much. Derek has been a really great lead and help and support with this. So thanks, Derek.
Good to hear. Thank you. So not seeing any other questions or comments. Mr. Juni?
I just wanted to mention, Jovan, with the trainings that you would like to look into for trans femme staff or outreach workers, if you need us to reach out to, after you meet with Luna, to either block by block or the sheriffs, if they can be any support in this work, just let us know.
Thank you so much. I'll reach out to Derek and we can have a conversation and see what would be the best route for this training. But I really appreciate that.
Great. Thank you.
Thank you.
All right. Thanks, everyone.
Thank you. Thank you for the report. Good evening. All right. On the next unfinished business is the 5-year mid-year report on the HIV initiative. I believe Dr. Celius is with us. And there he is. And there will be no slide or presentation. You have all the information in your packets. So what I would like to do is move right to questions from commissioners or comments and open up the floor for any questions or comments. Anybody want to go first? Vice Chair Palmieri, please.
Chair, I would just like to possibly give the new commissioners, not from me, from Dr. Celius, a little bit of what the initiative is. Maybe they may not be aware of it. The report is great, of course, but this is something that we've been walking through and they haven't.
Well, the history of I'd like to pass that to David if I could, but part of it is, or 99% of it is to end HIV transmission and in the city of West Hollywood in 5-year plan. And so what we've done is set up a way of checking on how this is being done and also stigma that may arise from trying to do such a program. I'm sure David can say it better than I can.
Well, when we actually anticipated this, I asked Aaron if he might have a brief overview of the initiative for the new commissioners. But as Chair Davis mentioned, this initiative came from council. I believe it began in 2016. There are 4 overarching goals of the initiative that Aaron will talk about, and he'll mention how we measure success. It is to reduce HIV transmission. One of the unique features in this initiative is that we are doing our best to address HIV stigma, which persists even today. So that's one of the unique features of this plan. I'll turn it over to Aaron if you could just go through the 4 overarching goals, some of the methods for measuring progress, and then we can answer any questions that folks have.
Sure, thank you. Thanks for having me. So yeah, as everyone has mentioned, what we know about West Hollywood is that it has a historically high rate of new HIV diagnoses, as well as people living with HIV. Approximately 13% of men in West Hollywood are living with HIV, and they represent 99% of both people living with HIV and new infections. Based on that HIV surveillance information, the community with a variety of stakeholders developed this HIV Zero initiative, and Maroon Society, my organization, we helped develop the initiative evaluation metrics. And it has, as David mentioned, 4 broad goals. One was to increase access to healthcare. We know that when people are in care and have access to adequate and culturally competent health providers, they're more likely to both be virally suppressed, receiving the medication they need and support they need to be virally suppressed, as well as having access to the compendium of tools available to avoid HIV, like PrEP and PEP. And so the first goal was to increase access to health insurance. And for those of you who have had a chance to read the initiative, that's one of the highlights thus far of the initiative, the ability of the community to really get everyone, or not everyone, but a wide majority, over 90, almost 90% now, of people in care. The second overarching goal of the initiative is to reduce infections. At the beginning of the initiative, we had set a goal of getting below 44 new HIV infections or diagnoses per year. And as of the most recent surveillance data, we know that that number is below 27. So we have far surpassed that goal. The third goal is to reduce HIV-related disparities, and that's measured based on the sort of the three main points of linkage to care, viral suppression, and retention in care. And that is an area that, if you read the report, it requires more explanation, but that's the third overarching goal of the initiative. And then the fourth is reducing AIDS diagnoses, and that's when a person's viral load drops to a point where they're considered in stage 3 or having AIDS. And that is another area where the community has really done extremely well. So reducing AIDS diagnoses as well as AIDS-related deaths are way down. And so of the 4 primary goals, the community has done a fantastic job on 3, like unequivocally. But the third, HIV disparities, that requires further explanation, and I'll leave it there for questions. Oh, you know, let me add to that too for commissioners. So the way we're measuring this, there's a variety of ways. One primary way is HIV surveillance data, which comes from the LA County Department of Public Health. That data is available typically annually, but there's an 18-month lag. And so understanding how well the community has done, we know how well we've done as of 18 months ago. And that's just based on Centers for Disease Control, data handling and management. And so that's one primary piece of data we're using. Another piece of data that we use comes from organizations like Trans Can Work and other social services providers. There are approximately 13 social services contracts at any point in time that focus on a variety of the different areas that we're measuring for success, including access to healthcare, providing social support services, substance abuse services, jobs, training, and a variety of social services. I'm not going to go into all of them. And so that data comes from working collaboratively with the contracted social services providers of the city. And the third major piece of data that we use to measure, David mentioned, is doing a biannual survey on stigma. We know that stigma persists across the country. It's no different in West Hollywood. Stigma exists for those who are living with HIV and those at a heightened risk, even in a place as progressive and accepting as West Hollywood. And so we are measuring every 6 months how people's experiences are with stigma, and we're looking at that related to how comfortable they are communicating their sexual behaviors and their concerns about HIV with their medical providers. We're also measuring that with how comfortable a person is communicating with new sexual partners, their HIV status, as well as their awareness of different medications that are available, like PrEP and those types of tools. Over the past year, with the emergence of COVID-19, we've also included relevant topics about COVID-19 to understand the extent to which people in the community are more concerned about acquiring COVID than they are HIV, and the extent to which concerns about COVID-19 are preventing people in the community from accessing healthcare. So, knowing that information is helpful, so we can maybe work with social services providers to help overcome some of those barriers to care, which are really, as is the first goal of the initiative, making sure people have access to health care is paramount to achieving the goals of the initiative. And I'll leave it at that.
Thank you. Thank you. So, commissioners, do I have any questions? or comments? Commissioner Darvish, would you like to go first?
I just wanted to comment on the great work that is being done. I did read the packet. I was wondering about the history because it started, I believe, in 2014 through City Council. And I had thought that maybe it's something that started way before then, but at any time, I guess not too late. And the results were amazing. I looked at sort of the numbers on the graphs, year-over-year results. I had two questions related to that. One was if the sort of Obamacare or the mandate, the healthcare reform, if that also contributed to some of that success because it was mandated coverage or just funds from federal government to the states for coverage. If you all thought that might have helped a little bit for people that were covered, especially young people that then got healthcare. And then the other thing was the privacy part of it. What kind of challenges you're facing in collecting that information, or just reaching out to people in the community if they're open to discussing their healthcare or challenges, or is that a challenge, or maybe not anymore?
Sure. So thank you for the questions. And yeah, I'm really proud of what the city and the social services providers have done to achieve the goals that have been achieved thus far. The planning did start in as early as 2014. The actual plan was approved by City Council for fiscal year 2016-17. So many of the social services contracts, or at least some of them, had already existed. I would assume for some time, but we memorialized a lot of those into the initiative, those that made sense, that could contribute to this overall goal. So the first question about Obamacare, we haven't, or at least part of the evaluation team, we haven't really discussed with the social services providers the extent to which they believe that having the Affordable Care Act has helped them help navigate people and enroll people in healthcare. I assume it has, but that is not a question that we've asked some of the providers, but it's probably worth asking. And to your second question, in terms of resistance people may have, I'm assuming you're referring to the biannual survey on stigma. So with that, we've been, Maroon Society, my organization, we've been conducting surveys in person for years. So we've done over 100,000, in-person surveys. And so if there was resistance, we haven't experienced it that much. The way we handle sensitive questions, our surveyors are usually in the field with a tablet, and in a question that may be sensitive, we allow the participant to select the answer in the digital tablet themselves. So we haven't really experienced any major barriers to getting people to participate and share their experiences honestly.
If I could add just a little bit, Commissioner Darvish, to your very first point. We looked at the initiative and putting this together as an opportunity to really give structure to what the city has been doing since cityhood, since 1984. The very first grant, social services grant, that the city provided was to the center, now the Gay LA LGBT Center, for, at the time, HIV testing and treatment. So the city really has been addressing HIV and trying to, eventually get to zero since cityhood. They've dedicated, as you'll see in this funding process, the city has dedicated on average about a third of its overall funding towards HIV or HIV-related services. So we were excited about this plan that, as I said, came from Councilmember D'Amico and Duran, who are both openly living with HIV. And this was an opportunity to take all of those contracts and the strategic partners that have been doing this work literally since 1984 and give it structure, and to be able to report to the community on progress made and challenges, as Aaron mentioned. So you're correct. It seems like, okay, so what took so long to get a strategic plan together? It really just organized what the city has had in place for years.
Thank you for that. And I've lived here for 27 years, and I knew that the city has been doing a lot, and I've seen those trucks that do HIV tests on Santa Monica many years ago, and just different pieces of it. So, but this is great though to bring it all together and sort of bringing it home, and you know, and also a lot of data that's been collected that's helpful moving forward. So great job.
Thank you, Commissioner Roberts. Thank you, David. I knew you'd say it better than I could. Do I have any other questions or interests, comments? Commissioner Shandrick.
Hi there. Just a quick clarifying question. I know the report says there's some concern about the data trend for linkage and retention of care, and I know Dr. Celios, you said there's definitely more to discuss, and so if someone if someone goes to one of our service providers and receives a positive HIV result, and they go to their own private insurer, or to their HMO or Kaiser, and don't retain service with that organization, would they not be counted in retaining care?
That is a good question. I know this is a conversation that Derek and I had earlier. I mean, not to the extent of specifying. It has to do with the distinction between community members that are on Ryan White, which represents most of the data from public health, versus those who are in private care. And so that's the specific question that you're asking about, whether someone gets tested in one location and then is linked. I don't have the answer at the moment. I don't know if Derek has the answer, but that's something that we could find out. I think that I don't know how they do the reporting for that.
It is unlikely. I'd like to ask, I don't know if Jeffrey's on the call yet, to see if he might know the answer. And is he there? He is. Okay, great. Jeffrey, do you know if folks that, let's say, the test at the center, they test positive, but yet they go to their private insurer, private healthcare provider, if that's counted to if that is reported to the county?
Yes, it is.
Okay.
Our process is that we have to have them sign a release form, a medical release, in order for us to contact their private doctor to say that they went to their first doctor's appointment and they started their meds. In order for us, there is a pay by performance component with our funding for HIV testing and linkage. So in order for us to get credit for that, if a client decides that they are going to go to their private provider, we have them do that in order for us to count that as a linked person into care. So that is our standard. And we actually do very well with that. We work very well with, especially in West Hollywood, with a lot of local providers. They're very great with confirming clients. And all we're doing is confirming that they went to their first provider, they were prescribed medication, and that's it. I mean, we just want to make sure that they actually got the care that they need. And if they didn't, that we go back and reach out to them to see if there's anything else we can provide as far as healthcare. Maybe they found out something about their insurance or something different. But yes, we ensure that they get linked in that manner, and that is recorded and reported to county.
Perfect, thank you.
Can I follow up with that question? So I think what Commissioner Shandrick was getting at, and correct me if I'm wrong, is the extent to which there may be an undercount of linkage. So if someone goes to, say, the center, tests positive, and then you don't have the ability to contact them, then they go to their provider. Who gets credit for linkage? Or is it possible that they're not being counted? Am I correct?
Exactly. So a lot of people, of course, go to Planned Parenthood or the LA LGBT Center for their sexual health and STI testing, and they may primary care doctor maybe at Kaiser or Cedars, and so it seems like if they are linked to care, they are being counted, and that this cohort that isn't linked to care truly isn't receiving follow-up.
I mean, I will just say for everyone we test that test positive, this is what I say every day. It's our whole purpose of being here.
Yeah.
So if we don't link someone to care when they test positive, then we're not doing our job. So we will definitely, and it can be, in the worst case scenarios, it can be months later, but we're still tracking a person down. I hate to say it that way, but to ensure that we're getting them into care and getting what they need. You're right, there are some other places that test who probably don't have the resources or different things like that, who aren't into that. But I know like AHF and us, we all have those same processes to ensure that someone who tests positive with us for sure are getting linked to care, whether it's with us or outside. I will tell you, it is very rare with us that we test someone that does get services outside of us. The only real is more not even Cedars. We have no issue. We usually are working very well with Cedar providers, is with Kaiser. But even with Kaiser, in the worst times where we can usually, we know all the infectious disease specialist providers there at some point either worked for us or studied under us at the center or in some way, shape, or form. So we have really great relationships in order for us to keep those, the data and ensuring, again, mostly what it's about is getting the patient in care. So as far as if they're testing with us, I can assure you we really are reporting the linkage portion.
I'll just add to that. Linkage is only counted if it's within 30 days. So to Jeffrey's point, even if they have to follow up with someone months later, but they eventually link them to care, they're in care, but they did not successfully, that was not a successful linkage as far as HIV surveillance data from the county is concerned.
And that just recently changed.
Oh,
I'm sorry, everyone. This is your secretary. We're speaking on item 3B for the presentation. Can we stick to the agenda? Thank you so much.
And I wanted to clarify for Jenny, who we've been communicating with each other. Jeffrey was not planned to be a speaker for this item, but as he represents the Gay and Lesbian Center, which is one of the strategic partners that is supporting the HIV Zero initiative, we definitely appreciate his input towards this item. But as Jenny said, this wasn't part of the scheduled presentation. So if we could kind of finish up this part of the conversation, and then Jeffrey will be back because he is one of the presenters for the final item, which is on PEP services. Thank you, Jenny.
Commissioner Meltzer.
Thank you. I have a quick question. I noticed that it said, and I know that women came up at a past meeting when we were talking about women with AIDS. It says there are less than 1% of cisgender women who live with AIDS, and they're not counted in order to protect their identities. Does that mean that we do not protect the identities of men?
So it does not mean that. Everyone's identities are protected, but numerically, if someone is living within a census block or tract or even a zip code, and there are only 5 or fewer people with HIV, they're not going to give out specificity about that for their protection, so that someone can't potentially identify them within that geography. Those are the CDC guidelines for reporting.
Thank you.
Commissioner Darvish, did you have another?
Yeah, I just had a quick question about emotional support, and I think I got it. Where the test is done, then the results are announced to the to that person by a physician, or is it just a technician? Normally, is by a physician, right? And the main question I have is what kind of emotional support is provided to the person that's positive then? And how do we follow that through with limited resources that there are out there with, pandemic and the rest of it?
Sure. So the providers that are testing, they have been testing for decades, and they have, from my experience with them, highly qualified, highly skilled people to both administer the tests as well as communicate the results in a compassionate, thoughtful, and informative way, so that they can make that warm handoff to the provider within their organization or within another organization. And so in terms of emotional support, I'm confident that all the providers that are currently part of the HIV Zero initiative, and some of the stakeholders who are not, but are peripherally providing services that are similar, have all the qualifications to make that the handoff and to provide a warm, emotionally supportive communication about a positive status.
So I can add to that, Commissioner Darvish, and I'm sorry, my screen's a little funny, but we do have in our contracts with the agencies programs specific to that. Being Alive has an ongoing group and provides emotional support for newly diagnosed folks with HIV. The center has a history of working closely with Being Alive. So if someone tests positive first time, to link them to Being Alive for those services, or the center itself, part of our contract, as you know, is for mental health services. If there is a crisis that's involved with that diagnosis, they can do a warm handoff with that community member into counseling. And they do provide, even though there's a wait list for individual counseling, they will provide brief crisis counseling for folks if needed.
Anyone else who hasn't asked a question or made a comment? Actually, no. Everyone seems to be happy. I actually have a couple of questions for Aaron from the report, and it's about the linkage to care is dropped 14%, and the retention has dropped 9%, and your what is it called suppression among the viral suppression has actually dropped as well. So is there an answer to any of that? Because I can understand how a couple of things can be miscounted. If a person goes and is tested one place and goes to a doctor in a different place, but this suggests that people are not going to the doctor, that people are not being linked to care, and that people are not suppressing their viral load. So, and that instead of going up, it's going the wrong way, in my opinion. So I wondered if I'm either reading it incorrectly, or if it doesn't seem to trouble anyone else. Perhaps I'm just being kind of a worrywart, but it does trouble me because a couple of things have gone up. So this, I don't know if you can get my question out of that.
Sure. Thank you for the question. So I think, no, it's always good to be not necessarily concerned, but mindful of the data and understanding what trends are happening. The numbers that I think I think those numbers are important. I think what's really important is the fact that the number of new diagnoses have gone down significantly. That's a big one. But when it comes to linkage, we want to look at the data really, although we're showing it from 2014 to 2018, the initiative really started in fiscal year 2016-17. And within that period of time, the numbers haven't declined so much. We would like to have seen them increase, but they haven't. And so that's the part that I was saying kind of requires a little bit further conversation. But in terms of linkage, we touched on that a little bit with Jeffrey earlier. We would like to see more linkage to care. Those numbers can be, we would like them to be better, period. I mean, within 30 days, we would like everyone to be linked to care. And it's unclear why the numbers have trended down since 2014 and since 2016. Although they haven't trended down that much because we're talking about 27 people, but still.
And Dr. Celius, I'm wondering too, when it comes to viral suppression, in the report it's laid out the folks that are retained in care, I believe the viral suppression rate is somewhere around 90% for those retained in care. There was about 730 people or so out of the total of people who are living with HIV in West Hollywood, where it's not known if they are in care at this present moment or not. And that could be for multiple reasons that we just don't understand, because we're just looking at the surveillance data as it stands. We're not looking at anything else other than that, because that's all that public health can give us. But Aaron, am I correct in saying from the report that out of the folks that are engaged in care, retained in care, there's a much higher viral suppression rate among those folks?
Correct. So the way the data is reported by the county is that we know that we know the people that are engaged in care, the people that actually are going to health providers, they are virally suppressed at a rate of approximately 90%. And so the base, though, is of everyone living with HIV, including the 718 individuals for which we do not have reported data. So we don't know if they are engaged in care and their providers are not providing data to the Department of Public Health or not. But the people who we have data on, they're virally suppressed and they're retained in care highly. So it's the 718 people that get counted as a zero, which is driving the number down. Now, it doesn't mean that those people are all retained in care and everything is great in their lives. It just means until we know more about that 718 people that are unaccounted for, the numbers are going to be lower because zero.
All right, so then what you're saying is I can relax a little bit about this, not get so stressed out about it.
I think so. I think that the focus is, all right, so the people that we know our service providers are touching, the lives of whom they're touching, they're doing very well. They are virally suppressed, they're engaged in care and retained in care, and their viral load is 90% of them are virally suppressed. So the question is, who are the 718 that are not accounted for?
And we can only make assumptions about those 718. And I apologize that my computer went out, so I missed part of this. So I don't know if I'm repeating myself or not. I missed most of what Jeffrey said, but the center, Men's Health, AHF, all of our local providers that are contracted with the county are required to report linkage and retention and care. So that's the strongest data that we have is from our local providers, not so much the other folks that are testing, testing folks in the local area that aren't connected with our local providers. So as Aaron mentioned, we can be very confident in knowing that the providers that we are working with are linking and engaging people, and those folks are virally suppressed.
Well, another very small, maybe just me, but when you're here among COVID-19 vaccinated, you tell me that 92% of my community is vaccinated, and another 4% wish they were or have intended to do so. But then the fear of COVID persists. That line, it's sort of just floating there. It doesn't say why my fear of COVID is persisting. It appears to me that the community I live in is not really afraid of it because they're vaccinated and they're taking care of themselves. So, I don't know, I guess it's those few words are just floating there. There's no period, there's no explanation, and there's no real reason for it. So I'm not certain if you want to leave that there or if there's a better way to say it, but it annoyed me. So I underlined it a couple of times and tried to figure out where you were getting this or why you were getting it, and it didn't make sense. Instead, I would have liked to maybe seen the fact that congratulations is in order for the citizens of West Hollywood for the high level of commitment to vaccines and the fear. I'm not necessarily afraid. I mean, I am worried, but I'm certainly not afraid. So I don't know if you want to correct that or if you like it, but it is just floating. And it just sort of, it doesn't really have anything to do with anything. So I would like to point that out and wonder what it was you were thinking about.
I would agree with you, and it's annoying me that I see this because it's an error. It should not have been there. It was, I think it was a title that we were thinking of, and it's an error. It should be out of there.
It just didn't jive with the rest of your report, and so I was curious. Thank you. Any other questions or comments from anyone before I move on?
Great job on report. Very detailed. From a PhD, Aaron.
Yes. Actually, you can be thanked for all of us because it is a very good job. I think a couple of us have been here since you first started, and it's improved a great deal. So thank you very much. Thank you, Derek. For
someone with a hand up.
Back and forth.
I think Commissioner Freiberg had her hand up.
Commissioner Freiberg, I'm sorry, I didn't see you.
It's okay. This might be a question for David, actually. A little while back, Jenny had sent out a HIV and aging fact sheet. And one of the first things they talked about was, although older people visit their doctors more frequently, they're less likely to discuss sexual or drug use behavior. And some healthcare providers might not even ask patients age 50 and older about these issues or test them for HIV, and it goes on. And then it says, many people may even mistake HIV symptoms for those of normal aging. So I'm wondering, are there a lot of doctors that just aren't asking patients, or even having this conversation about them? I mean, I don't think my doctor has ever brought it up, but is this something we could work with healthcare providers just to make sure that they are asking these questions and bringing it up?
I think we can pull in Aaron and Derek on this. When we, the Stigma survey does ask that specifically. Are you, comfortable talking to your doctor? Does your doctor, talk to you? Do they initiate those conversations? And then we break down, we analyze this data according to age groups. So we could come back, Commissioner Freiberg, and give you some, data that's specific to older adults, 55 and over, if how they are responding to those conversations. I can tell you qualitatively, I think you are, correct. I think it's kind of the target population. People make assumptions, including medical care providers, about who of their patients they should have those conversations with and who they, they perceive there's not a need. So that is part of the, that fits in with this initiative, and the whole goal is that we want, we want first off the providers to have those conversations, and we work with our contracted providers, which you'll hear from two of them at the end of the evening, specifically about this. They're talking to their patients about pre-exposure prophylaxis and post-exposure prophylaxis and sexual behaviors and the need for those services. So without going on, you're spot on. And that is one of the goals of this initiative, and one of the goals to identify, especially with our contracted providers and other providers in West Hollywood, identify who is not having those conversations and how we can support them and educate them to have those.
Just want to add one thing to that too. So when we first started this initiative, we had kind of a theory that folks weren't feeling comfortable talking to their provider about sex and sexuality and HIV and STDs. But what we found over these past couple of years is it's quite the opposite. I don't know if Aaron has any data in front of us, but we see less and less people feeling uncomfortable speaking to their provider.
Right. It's typically in the range of 90% are highly comfortable or more having conversations about their sexual sexuality and sexual practices and questions with their medical providers. But in terms of resistance and barriers to that, that would emerge by age. We ask people if their provider is discussing with them pre-exposure prophylaxis. And so we can do that by age, because that would be an indication about whether or not their provider had any preconceived notions about people's sexual practices after 55. As well
Commissioner Melton.
Hi, that fact sheet, I believe, came out of my county commission, the LA County Commission for Older Adults, because we had a panel about HIV and aging, and I had asked them to put a fact sheet together because so many people, providers of all kinds, who are working with people, with men with HIV who are older, have no idea what to do. They just have no idea what to do. So if anybody, we still have that fact sheet, David, I hope, so perhaps we can send it out again.
Absolutely. One other thing, Commissioner Freiberg, I wanted to mention, because you, in passing, you said that, I believe you said that your provider doesn't have that conversation with you. And that was one of the reasons and justifications that the city, with the commission's recommendation, got into the contract with Planned Parenthood, because we felt like we needed to have more options for reproductive health, sexual health services, specifically targeting women and women of all ages. So it's all the things that you're bringing up are things that we always need to, discuss and really kind of, suss out. Do we have those, those providers that are going to have those conversations? So I just appreciate you bringing that up.
Thank you.
Good question. Thank you all. So I don't see anyone else's hand. Okay, I believe we can move forward then. And since I've lost where I'm at, report on social service utilization by community members of color over the last decade. And it looks like I've written down Doug and Katie for this. So I will let them take over.
Thank you. Good evening, commissioners and members of the public. I'm Doug Nguyen, Transportation Program Administrator for West Hollywood. With me tonight is Katie Egan, Social Services Program Administrator. Tonight, staff will be providing an update on social services utilization by community members of color between contract years 2011 through 2020. Next slide. In the fall of 2020, City Council directed staff to study the social service needs of people of color in West Hollywood. In the spring of 2021, city staff presented a report summarizing service utilization by individuals served by the city's social services partners during the 2019-20 contract year to the Human Services Commission, the Lesbian and Gay Advisory Board, and the City Council. That report included a summary of demographic data by service category and provided an analysis of service utilization by community members of color. This report expands the study presented in February to include feedback from both the Commission and the Advisory Board, as well as demographics collected over the last 10 years. Next slide. Contracted agencies provide demographic information for community members served every quarter to the city's social services division. Demographics reported include race, ethnicity, gender, age, and household language spoken. Staff used demographic reports between the contract year 2011 and contract year 2020 to complete the analysis. Next slide. Staff analyzed client demographic information by service categories. These included employment, financial assistance, health, mental health services, HIV, sexual health services, homeless services, legal services, food and nutrition, senior and disability, substance abuse, transgender services, and youth services. Next slide. This table provides an overall view of who utilized services between October 2011 and September 2020. A total of 92,417 community members access to city social services in the last decade. Of the 92,000, 68% were white, 28% were community members of color, and ethnicity information was not known for 3% of the clients. In 2011, 23% of those who utilized city social services programs were community members of color. Between contract years 2012 and 2019, the programs were social services utilization by community members of color averaged 28%. It's important to note that between 2011 and 2020 social service contract years, individual community members could receive social services more than once and from multiple agencies. Because of the way that West Hollywood contracted agency partners report data, city staff are unable to remove duplicate community members from the total number of people served. For this reason, the number of people served may be inflated due to duplicate data. The 92,417 figure does not represent an unduplicated count of community members who received service over the decade. Next slide.
Great. Thanks, Doug, and good evening, commissioners. This is where I jump in. Now that we've provided an eagle's eye view of the data, I'll go ahead and dive into the numbers a bit more. This table summarizes the utilization of social services programming by service category between contract years 2011 and 2020. The first column lists the service category, followed by the number of clients who utilized programs grouped in each category. The next three columns list the proportion of clients who identified as persons of color, followed by the proportion of clients who identified as white, and lastly, the proportion of clients whose race and ethnicity was unknown. Service categories are organized from those who had a higher proportion of clients of color to those who had a smaller proportion. As you can see here, the three service categories with the highest proportion of clients of color were transgender services, youth and family services, and homeless services. On the other end of the spectrum, the three categories with the smallest proportion of clients of color were food and nutrition services, legal services, and senior and disability services. Next slide, please. This table summarizes changes in social services utilization by community members of color over the last decade. The table is organized from categories that saw the most growth in service utilization to those that saw a decrease in utilization by participants who identified as non-white. Again, as you can see in the table, the four service categories with the most growth are transgender services, employment services, substance abuse services, and senior and disability services. The four service categories with the largest decrease in utilization by people of color include homeless services, health and mental health services, legal services, and youth and family services. Before reading too much into these numbers, there are a few important things that we want to note. First, the youth and family services category serves a relatively small number of participants per year. Due to the small sample size, changes in service utilization by a demographic group disproportionately impact data presented as percentages. So although we see a relatively large decrease in utilization by people of color, that decrease represents a fairly small shift in the total number of people served. Second, due to how the data is reported, the differences between fiscal years of service were not tested for statistical significance. Some of the changes seen here may not be significant, meaning that a change in the percentage of people of color served over time could be due to chance rather than another underlying factor. Next slide, please. As you may recall, at the February Commission meeting, staff were directed to provide a demographic comparison of the individuals utilizing social services with the city's population as a whole. In 2019, the City of West Hollywood released an updated community study, which provided a demographic analysis of housed residents using the 2016 5-year American Community Survey, or the ACS. Looking at this graph, the yellow bars represent data from the community study, while the black bars represent data collected by the city's social services providers. As you can see here, the percent of housed residents in West Hollywood who identified as non-Hispanic white in the community study was 74%, compared to 68% of those who utilized social services. 12% of housed residents identified as Hispanic or Latinx, and a similar 12% of those who use social services identified similarly. 4% of housed community members identified as Black, compared to 8% of those who use social services. 5% of housed community members identified as Asian or Pacific Islander, while 3% of those who use city social services did the same. And 4% of housed community members identified as another race, compared to 7% of those who utilize social services. While the community study can provide a helpful point of reference, it's important to note that the demographics provided through the US Census are not always directly comparable to the social services utilization data. Individuals receiving social services may be systematically different from the overall population. For example, some agencies providing food and nutrition services have a target population of older adults aged 50 and over. However, the older adult population in West Hollywood may differ significantly by race, gender, or language spoken from the when compared to the total population. This makes it difficult to provide a direct demographic comparison between the two groups. Demographics from the community study are also limited to housed West Hollywood residents. However, city social services are provided to a wide range of community members, including anyone who works, lives, goes to school, owns property, or experiences homelessness in West Hollywood. Therefore, individuals who access services through the city may differ demographically from city residents. For example, Black, Indigenous, and other people of color are disproportionately represented among the homeless population due to centuries of systemic racism in housing, education, and the US economic system. This makes it more likely that individuals of color will receive homeless services at a disproportionate rate when compared to the demographics of housed residents presented in the community study. Next slide, please. To give everyone a clear picture of how to read and interpret this data, we wanted to walk the Commission through some of the data limitations that were identified in completing this analysis, as well as some information about how those issues may be impacting the numbers. The first thing to note, and Doug had mentioned this previously, it is possible for a person to receive services from multiple agencies within the same service category. For example, a white community member could receive services from Trans Latina Coalition in January and then receive different services from the Transgender Economic Empowerment Project later in the year. This would result in duplicate data in the transgender services category and cause the demographics report to show an overcount in the number of white community members served. Contracted agencies do work with clients to identify and coordinate with other service providers, but at this time, data is not reported in a way that would allow city staff to identify and remove potential duplicates. It's also important to note that partners provide, apologies. It's also important to recognize that partners that provide services across categories are currently limited to the primary service category for that agency. For example, the LGBT youth program provides youth services, but demographic data reporting for the agency is only included in the homeless services category. For that reason, each service category gives a snapshot of community members served throughout the year, but does not necessarily incorporate all community members who received that specific type of service. We also wanted to flag that demographics data reported by contracted agencies is not broken down by services received or by target populations. So some service category data may include individuals that did not actually receive that type of service. For example, JFS Comprehensive Services serves both older adults and people with disabilities of any age. As a result, the senior services category is combined with the disability services category and includes data for people who are not seniors. Addressing these data limitations and gathering information beyond what we have presented here will play an important role in our next steps, which I will dive into now in the next slide. So in the immediate future, staff will present this report to City Council and the Social Justice Task Force for feedback on August 16th and August 24th, respectively. Input from tonight's meeting and from other city stakeholders will be essential and will guide the project moving forward. City staff also recommend inviting a panel of stakeholders from other relevant city commissions and advisory boards to a future Human Services Commission meeting to review the demographic reports and provide additional feedback. In addition, while this retrospective analysis provides some insight into how social services were utilized by West Hollywood community members over the last 10 years, it does not clearly identify unmet needs or existing barriers to service for people of color. Additional research and analysis are needed to understand current gaps in service and disparities in outcomes, particularly among Black, Indigenous, and people of color. To address this, city staff recommend hiring a consultant to conduct a needs assessment focused on community members of color. A needs assessment will allow the city to gather critical information that cannot be gleaned from administrative data alone and present an opportunity to hear directly from people of color regarding their specific needs. An RFQ for a needs assessment will be included in the agenda item to council next week. Staff can then use the findings from this report and the needs assessment to inform the upcoming social services RFP and funding decisions for the next 3-year grant cycle, which begins in October 2022. And with that, we will conclude our presentation. We are more than happy to answer any questions that you have, and thank you so much for having us.
Thank you, Katie and Doug, for the presentation. It's always nice when I unmute myself. And do I have any commissioners who would like to start with a question? Chelsea, Commissioner Byers, please.
Thank you, Chair Davis, and thanks, Katie. Oh my gosh, and I lost the other, oh, there you are, Doug. Thanks, Doug, for your presentation. I was curious, I'm really glad to hear about the needs assessment as a recommendation. I think it's just, it makes sense to figure out how we continue to deliver and where the actual gaps exist. But I was curious how intersectional that needs assessment would be. This is a demographic data based on race, and it feels like there may be other considerations to make in thinking about barriers and needs. And maybe we do a different type of needs assessment report for race, gender, sexuality, but I'm just curious to hear how the staff is thinking about that intersectional piece to that needs assessment.
Yeah, so in terms of this specific needs assessment, we're responding to the item that came from former Councilmember Heilman back in October. And in that item, it was specifically requested that we look at gaps in service and potential unmet needs by community members of color. So that has been our focus, but I'm always happy to hear recommendations and thoughts from commissioners about other areas where we might need to dig in.
Yeah, I appreciate that that's the case and the history of where it came from. And I guess the question then would be, are there other needs assessments that get done that cover sexuality, gender, and is there an opportunity, I guess, then to like overlap that needs assessment with this very specific one that would be conducted on race to give like a really thorough analysis of gaps?
Yeah, so I know in the community study that we referenced, there is some analysis regarding the community population outside of race. There is information and community feedback from different community groups and subgroups within West Hollywood. So I think that this needs assessment would be a really great complement to that community study, but also future community studies that we would do. I know right now with the pandemic, I don't know if we have any plans for that, and David can feel free to jump in, but I know that there will be more in the future.
I think to your point, Commissioner Byers, maybe you can elaborate a little more because we brought this for this input, so I appreciate it. I think, so we are, as Katie mentioned, we are taking this report to council on August 16th, and we have attached an RFQ for a needs assessment to be conducted. We have the draft RFQ document. You'll see it on the staff report once that's posted. Should be posted this Thursday for the meeting next Monday. I think in working with, whoever the consultant who is selected to be the consultant, I think it would be difficult to kind of separate out what you're bringing at the intersectionality, because so yes, this was driven by former council member Heilman's, initiative or council item from last October to specifically look at communities of color. But as we work with that contractor to do the engagement portion, and we've talked about, what that will look like, including accompanying our street, outreach teams that are, have access to a large percentage of community members of color who access services. I think that, that is going to be part of it, because they're working with all genders, all sexual orientations. So I feel like even if it's not as intentional, it will be, it's going to be part of this analysis. That we're not specific, that gender, age, language will all fit into this. We are, in releasing the RFQ and in getting this out, we're really looking for a team that is diverse, that will be as as kind of broad spectrum of representation on their their own team when they go out into the community. So we're hoping that that also will facilitate this assessment and identification of needs and barriers with as I mentioned, not just community members of color, but folks who identify with various genders and sexual orientations, age, etc. So I hope that answers your question. I think it would be hard not to kind of include that intersectionality, but also with with your comment, I think that it's important that we include this in the in the conversation and what we're looking for.
Thank you. Yeah, I appreciate that. And it definitely speaks to it. My point just being that I think, the experiences of a Black trans woman would be different than a, than somebody different. So I just like taking that nuance to these categories feels like to do that type of needs assessment would be really interesting to get that type of minutia and data. And maybe it's not what this is set out to do. So thank you for saying all that. I appreciate that.
Any other commissioner have any interest in Commissioner Darvish?
Yeah, great job, Katie and Doug. A lot of information in here. Kind of got so many great graphs and data that's been collected. I kind of get a little lost there. I'm more visual when it comes to comparison between 2000 or from 2011 to 2019. And I think you mentioned, Katie, in the beginning, something about the population. Was that counted in? Like, did you look at how many people of color in the city in 2001 or 2011 through 2020? Is that in the information here so we can see if the utilization increased or decreased? Was that because of population growth or drop in population?
Yeah, so on one of the slides, and I don't know if Jenny's able to pull it up, but on one of the slides we were showing the comparison of people of color within the city of West Hollywood as reported by the US Census, and how that compares to people who identified as non-white who received social services in that same time period. So, and it looks like the slides are coming up. So I think it's two slides down. The graph.
This one?
Yes, there we go. So the bar in the yellow bars represent the West Hollywood housed population. So this is on average. So I should say the yellow bars represent the percentage of people who identify as different racial or ethnic demographics. And that is specifically from the 2016 ACS survey, which is conducted by the census. And then the black bars are the average percentage of people who identified as either white, Hispanic, Black, Asian Pacific Island, or other across the 2011 to 2020 contract years.
Right. But what I was trying to visualize was kind of year over year from 2011. What did this graph look like? And then the following and the following. not just
Specifically for people who utilize social services?
but the population.
Oh, that is a great question. I don't think that we included that information here in this report, but in the community study, there is a comparison, I believe, between the 2016 census information and previous years. So I'd be happy to send that along so you guys can reference that as well.
Okay, just based on your experience, though, did you see a growth in people of color in West Hollywood, or did it stay flat?
My understanding is that the percentage of community members who identify as persons of color has increased over time, but that increase has been relatively small, and that the city overall is still not as racially diverse as the rest of the county. But again, that said, there are systemic reasons why people who utilize our services may be more racially and ethnically diverse than the people who are considered housed residents within city limits.
Thank you so much. Great.
Yes, and sorry it took me so long to kind of sort out the question.
Commissioner Dartmouth, okay. Commissioner Mills.
Katie, thank you for that wonderful presentation. I have one question where you said that city staff recommends a panel of stakeholders from other commissions and advisory boards should get together and then I guess join with the Human Services Commission. Would it not be better to wait until a professional team is hired to gather all of that information, as opposed to doing it before that? Or do you think it would be helpful to gather all of that information before a team is hired?
Yeah, that's a great question. And actually, we were hoping to have the consultant lead that effort. So we'll be presenting this report to Council and the Social Justice Task Force and getting their feedback this month. But then I think that that larger meeting where we're bringing other stakeholders to meet with Human Services Commission, that will probably be further down the line once the consultant is already, the project underway.
Commissioner Shandro.
Hi, I just want to say I appreciate that the report, and Katie, you reiterating that the census data from WeHo residents is not necessarily a direct comparison of the community that utilizes social services. So it's never like trying to map. So I think that's just important to remember. There may be some crossover with residents, of course, in this a larger social service utilizer pool, but they are different, and so I think it's interesting, the report. It starts to kind of set some benchmarks, whether they're good or whether they're not good. It's kind of hard to tell, and I think you'll be exploring that maybe in more qualitative ways through this needs assessment. I think some things to include in the needs assessment would be things like access to technology, transportation, potentially financial cost, if those would be barriers for people of color receiving more or different services. And then I would just, the commission, especially the newer commissioners, this is a lot of data. It's a decade of data, and we don't have the same providers and the same services throughout. So there's some of this data could be choppy. As an example, maybe for half of this data, PATH was our main provider for overnight beds for the homeless community. They're near downtown Vermont and Beverly, and now Essentia has taken on that role, and they're in Glendale. So shifts like that could show up in the data. The youth service, I know it's a small pool. It seems interesting. I'm wondering if NCJW in their back to school backpack giveaway, which is no longer a current program, has kind of skewed some data. So there is a lot of caveats to the data. I'll just say that, and I think a needs assessment would be a good complement.
All right, Patrick, Commissioner Sanders. Anyone else? So, I would like to thank you for the report. It's a nice report. But it's a picture, and I'm not really sure where the city wants to go with the picture that you've taken. If you have a needs assessment and you have a consultant, there should be a point that they're headed for. So either I'm missing the point or the point is not illustrated to me here. But if I were a councilman and I just received this, I'm not really sure where you want me to go with this. Is there any way to answer that?
I'm happy to jump in, but I saw that David unmuted himself, so I can
well,
defer to you, David.
Yes, well, you can join in with me. We've had that very conversation. We had that conversation in preparation for this evening's meeting. I asked Katie and Doug to spend some time on that slide that we brought up again for Commissioner Darvish that compared the census data from the demographic report of the community study, which we will send you the link, it's on the website, to the access to social services. Because when you look at that, the access almost aligns, almost perfectly with the census data. So, but what we know, and so I, jokingly said to, Katie and Doug, I said, oh, so our work's done. The access to social services is as diverse as the city residents. But what we know and what Katie and Doug have been talking about is that the community members who can access the city's social services is a much more diverse group because it is folks who work here. It is folks who are homeless and spend a significant amount of time here. It's much more than just the residents. So it just goes to show there's much more work to be done. And then to Chair Davis's point, it's like, okay, so now we see that, we're looking at this 10 years worth of data. Commissioner Shandik's right, there's been changes in providers, it doesn't all match up, but it's still a good snapshot because we do it by service categories. So even though we might have different providers, we've been pretty consistent with those service categories. So what we need to know is, okay, so why don't we have more diversity in our access to services? And what's also very interesting to me is, certainly the services that are more frequently accessed by community members of color, we talked about it, they stressed it already, our trans services make sense with the providers. We've got trans Latina, we've got, trans can work, we've got TEEP, are targeting our trans community members. And frankly, that is looking at a larger swath of community members of color who are trans. And then we look at the homeless community members. Katie mentioned how, for reasons throughout history, why we've got, more community members of color who are accessing homeless services. I always like to say with that, and I've mentioned it to this commission, our homeless population does, even though it's more racially diverse, it does reflect a lot of West Hollywood. And as compared to the county, yet we have a higher proportion of people who identify LGBT, and we have a higher proportion of people who are living with HIV. So it looks like West Hollywood in some ways. So where we're going is, if we've got this diverse group of people who can access services, the one that sticks out to me, frankly, is why not legal services? Why is it low for legal services? That's an interesting one for me. It's not specific like food and nutrition, where, as Katie mentioned and Doug, that food and nutrition, a lot of our contracts, it's just for older adults. It's 55 and older, yet home delivered meals, or community members living with disabilities. That demographic looks different. And it's also for residents. It's not for that larger swath. So sorry, I'm going on, but what we're looking at, to Chair Davis's point, is what are the gaps? What are the gaps? What do we need to bring in? What do we need to tweak with these services to get more access by community members of color? What do we need in legal services? Do we need to do more immigration workshops? Do we need to do more? We already have them, but do we need to do more name and gender change workshops? What do we need to do to what are the needs of that community that we're not providing? So what are the gaps? And then what are the barriers? Why is it that we don't have more community members of color accessing legal services? And this isn't, to critique our current agencies. They're all working on outreach and getting out to the community, but it's just interesting to me, those that really kind of stand out. And that's where we're going with this needs assessment. We want to know, what are the barriers? And then what are the gaps? We've got a wide variety of services, but within those, are there specific programs and services that our community members of color need and we're not providing? And sorry, Katie, I just jumped in, and did you want to add to it?
No, not at all. I think you said it all.
I'm listening. I'm still interested in our goal. So what we're interested in is are we doing our job correctly, and are we creating some type of barrier to accessing services to begin with, and are the services available, or are they being targeted to the right communities? It seems to me to be a very wide scattershot, like whoosh. Whereas the HIV or say aging in place has much narrower focus, and I'm actually able to hold on to a goal. I do not feel that I can hold on to a goal from this report from the start of it. Maybe when you come back, if the council gives you what it is you're after, then you come back in a year. If I say 2 years, I may not be here, but 2 years, you'll have answers to the question that I'm asking. Because I'm really not certain why Commissioner Palmieri.
Thank you very much. So David, I was listening intently to everything that you were saying, and it's all very interesting. And I remember when Heilman brought this to the table, and some of it to me is relative and some of it isn't, and that's great, because that's how we gather information. But I think what Commissioner Davis is asking, what is the takeaway in 3 sentences? What is the takeaway for us? And this almost looks to me like HIV 0 looked in the beginning. There were so many things happening, we didn't know where to zero in on, and then it evolved. So what is the takeaway from this that will be sensible for us, or that we can clearly understand?
So we are looking at this kind of to counter Commissioner Davis's last statement. We're looking to bring this consultant on soon, and to begin to, for them to begin to get out into the community and conduct the assessment through various engagement activities. We would like the report, the results of this, to inform the social services RFP. Just as we, this may not be the right comparison, but just as we go to the boards, all the boards and the commissions, and we ask them, what are the gaps? What's missing? What's working? What do you see, as far as your constituency, what's needed? Leslie and I don't know, it was probably the holidays last year, we presented to the Women's Advisory Board. And, we presented, I think it was like the mid-year or year-end report, and we hadn't done that for quite some time. And their whole thing was, okay, so where are your services? Why don't we have more services for women specific to sexual assault? Why don't we have more services for women, for rape, for DV, for, and anyway, so we're looking for this team to get out there and to reach out to the community, our community members of color, and and engage and find out, what do you need that we're not providing? What would you need? What would a program look like? What does this service look like? And what are the barriers? I know I've had many folks tell me with with our brochure, the brochure that we all just worked on and got out. It's like, okay, so are you going to give that to, to an unhoused community member and expect that, that they're going to, we have the opportunity to ask questions. We did that mailing, and we get phone calls, and we get emails, or council gets contacted, and I don't understand what this service is, but I think I need it. So, how do we expect our unhoused community members, as you mentioned, to express that, what they need? One of you just mentioned the need for additional technology. We know that there is. We know, especially during public health crises like we're in and we continue to be in, how do we really continue to have that contact with our unhoused community members who may have a cell phone? We see folks using our smart bus stops to charge their cell phones, and and honestly, from the social services perspective, I'm glad we have that out there. For some people that don't think that that's what it's used for, but sure it is. And anyway, but we need to get that access. So we want to get this team out there and to engage and to be able to report to you and to council on what is needed. What do we need to look at with this next RFP?
Sorry.
I think Jimmy's point is well taken, that in the beginning, this may look a little too scattery for me. So it was like the HIV in a way. You did not give me 3 sentences, however. David went on a little more than 3 sentences, and I'm not sure I followed all of it. But I believe I can understand it, because I'm seeing you asking for things from council. These things that you're asking for cost money, and they also need to have some type of actual direction. And so I wanted to know if there was an actual direction before I would sign off on saying, hey, I think this is a good idea. I'm not saying it's not a good idea. I'm just trying to see if I can get some information that'll help me make my mind up. Commissioner Darvish.
I just can't stay quiet tonight, just listening to all of you. I think everyone has great points, from Commissioner Chandrick to David and all of you. Just being consider myself as a minority, someone that came here at the age of 19 and had a whole different. My mind is trained differently, and looking at the data. For one thing, I don't know if we can group all the people of color together, because each one of those different races or different, depending on how they were raised, they could be thinking differently regarding using these services. So I don't know if it's possible to at least take in the large groups of those people of color and put them in under one sort of measurement, being Hispanic, being, I don't know, Middle Eastern, being Black. They're so different than each other. To this date, I can't even think about going to a psychiatrist, because how I was raised, you only go, or your family takes you there if you're crazy. So a person does not go see a psychiatrist. They go to their friends, they go to their family members to open up and talk about issues. Using legal services, I haven't sued anyone to this date, because it's sort of a shameful thing to do in the culture that I was raised in. Although I've been here 40 years and I haven't changed. So again, the point is, yeah, we need to do that needs assessment, but I don't know if we can put all of them in one bucket and have an accurate measurement. It will give us some idea that, yeah, we need to do an outreach to see if they have technology, if they can find the services. That's good, but again, to really pinpoint, we have to maybe separate them. That's just my 2 cents. But great job, though. Just what you have is, just looking at it, it does show a good picture. And I'm sure the goal was to ensure that they have access, people of color have access to those services. And I'm sure progress has been made. But I think if you want to take it to the next level, from the needs assessment from a third party, going on the streets and talking to just people from different cultures or different countries or races, and have that, and then coming up with a goal that would be more it would be more sort of a laser point to where we want to go.
Thank you. Commissioner Meltzer.
Just a quick point about our unhoused residents. They, of all people, there are teams to go out and talk to that population. And I think we do know what their needs are, because there are constantly people addressing those needs and looking for ways to help that population. It's the other population. How do you reach out? How do we find, people of color? How do we reach out to them? How do we know where people are? I think that will be the difficult part.
Thank you. I just think you have your work cut out for you, in my opinion. And I will let it go at that. Is there any other comment or commissioner question?
Oh, job security.
Yeah. Yeah. So thank you for your report, Katie and Doug. Very informative. It actually doesn't look very much different than I would have maybe guessed on my own, but it is nice to see it in print, and it will be interesting to see what the council does with it. So with that said, I'm going to move us on to new business.
Thank you.
Sorry. Oh, and I'm going to move us on to new business, and we will start with Jewish Family Services, JFS, Arts, Wellness, and Engagement Programs. And I have written here, Kimiko Kelly. Did I say that correctly?
Yes, Kimiko Kelly.
Oh, Kimiko. I didn't see there was an I. He didn't give me an I, and when he said that, okay. Kimiko Kelly, I am going to turn over the floor to you. Thank you very much.
Yes, thank you. Wow, lots of interesting information this evening. A lot covered, so very educational. I want to start off saying hi. I'm the Director of Arts, Wellness, and Engagement Program at Jewish Family Services at the West Hollywood Comprehensive Service Center. And I'll also introduce my colleagues, Alex Pagan Mejia and Marina Goldstein, who are here, who are the activity coordinators along in our AWE program. And we were invited to share a little bit about our programming that's available for the West Hollywood community. And so I did have a little presentation, and Alex and Marina will be your contacts at the West Hollywood Comprehensive Service Center. They do the activities, and many folks and members are familiar with them. And then also Marina also has Russian language capacity too, as well, to serve the Russian community in the area. So they both have been with the agency for about 2 years, providing these services. So I think I think they might be getting the presentation up. So I think everybody's familiar with Jewish Family Services. We have 5 locations across LA. And one of our great partnerships has been with the city of West Hollywood. And we are granted and funded to provide services to the older adult community, and also to provide activities. We have, are we going to be able to show the presentation, or we're still, I don't know if we'll be able to.
You have the power to share your screen, or I could share on your behalf. Is that the presentation you provided to us?
Yes.
Okay. Would you like me to share for you?
Yeah, that will work.
Okay, great. Give me 1 second.
Okay. That way you can see what I'm talking about. But I'll just provide a quick overview of Jewish Family Services. And I have started there recently in February of this year during the pandemic. And previous to me, the person in my position was Mandy Carpenter, who you may have met before. So here's our agency and Arts, Wellness, Engagement, and just learning about the agency, that it was founded in 1854 as the Hebrew Benevolent Society, and serving those in need. So it serves all communities in Los Angeles. It provides food pantries, domestic violence shelters. We have special Holocaust survivor programs, as well as mental health and addiction services, support to older adults and families with children. As was mentioned in the West Hollywood Comprehensive Service Center, we also serve those with disabilities. And so we have a helpline, and we're a resource for the whole community, connecting to a wide network of services and resources. We do have 5 sites, as I mentioned. Our flagship site, our home base, is the Gunther Hirsch Family Center on Fairfax, where we have the Jonah Goldrich Multipurpose Center serving older adults. We have a site in the Valley Storefront Community Resource Center, and we work with the Jewish Federation, which has a site in Venice on the beach, Bar Center on the beach, which is formerly Israel Evans Senior Center, and Felicia Mahud Multipurpose Center, which is in Mike Bonin's City Council District, so serving West LA there, as well as food sites, Sova West and Sova in the Valley. So at the West Hollywood Comprehensive Service Center, while we're going to share about our ALL program, I did want to share that we do have 13 more staff available there that provide case management, counseling, information, referral, assistance with government benefits, home secure services, personal care assistance. They have a Connect program matching isolated seniors with volunteers for assistance, as well as the arts wellness engagement activity programs. And we do have robust staff that speak English, Spanish, and Russian as well. So for the arts wellness engagement program, we have lots of activities. As you all imagine, we had transitioned from in-person to all virtual classes now, but we have a regular weekly program that Alex and Marina put together with fitness classes, yoga, Tai Chi, dance, strength building, cardio, chair yoga, exercises for different levels of strength and ability, as well as mental stimulation, trivia games, English language discussion group. Marina runs the Conversation Cafe for those English learners, and lots of arts and entertainment. We have an art club. Fantastic Friday has entertainment. We have cooking classes, nutrition talks. Today we had a talk on Tennessee William provided by a theater group. So all kinds of engaging and interesting things. Monthly, we have a talk that features an opera. And then we have social discussion groups, an area that is rising in prominence as a need is more opportunities for engagement. So we have Seniors in Action once a month and an older adult discussion group as well. When we were in person, we used to do trips, bus trips monthly. We did several trips a month. Right now we're doing virtual tours. We'll do tours of the San Diego Zoo, the Georgia Aquarium, the Tenement Museum, things like that, as well as wellness workshops. And we do celebrations with partner organizations. We've worked with the LGBT Center. We work with the Russian Advisory Board, doing different events and, having a full calendar each month throughout the year. And here's a picture of our team on Zoom. You'll see Alex and Marina at the top there, and then Danny, who's at the Jonah Goldrich, and Chris, who's at the Valley Storefront. And just to show, what has surprised us over this time is that we're not sure people would join us on Zoom, but people have joined us on Zoom and do great activities along with the instructor. And it's surprising how well attended the activities are and that they do it consistently each week. And that we can go to the next slide. And so these are an example of our newsletter, which I will share with everybody in PDF. We have our August newsletter out now, and our September one will be coming out soon. That shows the list of, these are special monthly talks and events that we have. We try to have a diverse, entertaining and engaging calendar each month. And then also we have special classes in Russian. In August, we had an advanced healthcare directives workshop with our partner with Bet Zedek. We have an art club in Russian, and on Sundays, we have a wellness coach, Yana, who has a conversation and wellness talk on Sundays. So trying to serve diverse communities in West Hollywood. And then here is another exercise. We have our lovely instructor, Caesar, up at the top left, and really great instructors. And you see people of various abilities, and the instructors are very good in directing the group and doing activities to their abilities, whether they're seated or standing or with a walker, but really working with them. And we, like I said, we have various exercise instruction every day. So we're really working on the wellness, both physically and socially and mentally. And here's our, you can't really see all the weekly recurring classes, but you can see there are more than 20 classes per week that we offer on a regular basis. And people do like the consistency of having a class that they take every Monday. You know, some members say they've been actually more active now that it's been online because it's easier to access. But we will be working on transitioning. Our location is at Plummer Park, and we are in talks with them and how we're going to transition and try to start to do some activities and when in person. But the other thing to mention that I think is not always clear, and this is an example of an entertainer who's up at the top right again, providing some guitar and songs, sing-alongs that a lot of our members really like as well. We can go to the next slide. And then one thing we want to note is everyone is welcome to join. The classes are all free, they're funded. So they can contact Alex or Marina or I, and we can give them, you know, connections to our classes. We really want to reach out, and maybe many folks out in the community do not know that we have these classes available. So they just need to contact us and we will connect them and get them logged on. We also have tech support if they are interested but don't have the technology or just need some coaching along to get online. We definitely offer that because we know it can be a barrier to some, but we want to encourage sharing the information, letting as many people know that we have these free great activities. And the goal is to keep our community engaged and healthy and doing well.
Thank you. Very nice presentation. Do I have any commissioner who has any questions, comment? I don't want to start with Commissioner Darvish because that seems to be my go-to guy. All right, Commissioner Meltzer.
I do. Thank you, Kamiko. That was wonderful. I think what you've done is incredible, given that you had to pivot. You know, I really don't like that word, but you've done remarkably well. And I'm curious about the distribution because we have a lot of different older adult audiences. And is it reaching audiences who are not on a JFS distribution list or you know, how are you doing that? And I think I had this conversation with Alex at one point.
Well, that is, I mean, that's probably why we're here too. We really want to partner with all the agencies and commissions and advisory boards across the city to try to raise awareness of these activities that are available. You know, I think that's one of the hardest things is reaching out. How do you reach people? We have a printed newsletter. We have it digitally that we send out, and we try to distribute the printed one to different apartment buildings to let people know about our services. But definitely we welcome any suggestions or ideas on how to share this resource to the community. And Marina, Alex, if there's anything you want to add, I welcome you to. That's and then, oh, there we go. There's our newsletter. So you'll
okay.
Yes, and so this is mailed out to our members, but we also have extras that are printed that we try to distribute across the city.
Okay, because I don't get that as an example. I'm an older adult who doesn't get that. The other thing is, do you think that there might be a problem when you go back to in-person classes that people have gotten used to doing these things at home?
Well, there's definitely a group that tells us pretty strongly that they want us to keep the online classes, that it is more convenient for them, that they're able to do it. So definitely there's a cohort that's become comfortable and preferable to them. And so we're going to keep the online classes going. But then, of course, there's a group that hasn't been accessing the classes because they're not online for various reasons. And we just are working to try to maybe figure out what the barriers are. Is it technology? Is it just coaching along? Or maybe they're just not aware. So there's definitely a group that wants to get in person, but we will keep the online version as well.
Great. You're wonderful. Thank you.
Thank you,
if I may, we were also considering like having mixed classes, the ones that are live in person, and they will be streamed to our Zoom participants.
Great. Great.
Buyers.
Thank you. I really appreciate the presentation. Love to hear about these services. I first just went to the website and thought it was a really amazing like digital space to sort of understand and navigate what the organization's all about and has to offer, and really appreciated the accessibility menu that was there just right away. I thought that was a really amazing thing. And I realized that this was the first time I'd actually like jumped into checking out a website to see how these the like services of an organization were presented. And it was just sort of an interesting note that I want to keep for myself and sort of say out loud, because I think we get to hear so much. And then I'm sort of interested in thinking about how what we get to hear and understand about these programs and service delivery options, how it's presented then on the website. And then I'm glad I did that in this case, because I couldn't find that fabulous schedule of events. And I just thought I would, I was interested in signing up to, just kind of take a peek and see what it was all about. But then I couldn't find that schedule of events anywhere. So it's not so much a question, but just for such a fabulous website, I was concerned to not see this, regular calendar and wanted to flag that. But that's all I really wanted to say. Other than that, I was really, again, impressed by the navigability and the user experience, and feel like just the font size on the website was so impressive. Like, you really understand who's coming here and who needs to see this digital space well. So that's all. Thank you.
Yes. And I want to answer as far as the calendar. We have a full online calendar, but people access that once they become a member, once they contact one of our activity corners, and they have access to the Zoom events. But that makes me think that we could put a PDF of our newsletter on the website so people can see the activities. And then if you're interested in joining, we want you to fill out a waiver form first, and then you have access to the calendar with the Zoom links.
Thanks for explaining that. I appreciate that.
Yeah, and that's a good tip. We'll put that on there.
Commissioner Meltzer.
Yeah, a member of what, Kamiko? You keep saying member. A member of what?
A member of the AW program.
Of the
AW program.
Oh, it's
so I'll explain that. So when I first joined Plummer Park, we had like a membership system, so to speak, and participants can be and it was like a yearly thing. They would check in with us, so provide their address, their email, their phone. And that's how we, at least over this last year, how we emailed and then mailed our newsletter. So if participants were, they went to Plummer Park regularly, then they knew of the activity services. And then they were able to connect to our trips and whatever it may have been. Right now, obviously, actually the email portion of it for us was a newer thing. So I started in 2019, and I think it was a couple months that they started asking for emails. So we didn't have everybody's email, but we did have a couple hundred emails that we sent out to people. So when Kamiko references a member, it's the participants that were involved with our programming before the pandemic. And then now, obviously, we have a lot of newer people that got connected either through word of mouth or something like that.
Okay, great. Thanks, Alex.
And I would add those people who fill out the waiver because they need to register, they need to fill out the waiver first. And after that, they automatically are enrolled in the program and they get the schedule of the program. That's how it works. That's what a member gets.
Right. Thank you.
Mm-hmm.
I just want to jump in and say that I think the new format of the newsletter looks really good. I don't know if anyone on this meeting is responsible for that, but it has just a very nice updated look to it. And I just wanted to let you know how much we appreciate seeing that.
Great.
Actually, the engine is Kamiko, and we are supportive staff.
Oh no, we're definitely a team.
I also wanted to add that we have those newsletters in 2 languages, in English and in Russian.
And then to speak to the other communities in the West Hollywood, we also are looking to add Spanish programming to our programming as well.
Good. Oh, I turned myself off. Everybody's happy and we think we can move forward, or is there anything that
I say?
Commissioner Fry?
Yeah, I just want to say, Kamiko, this is amazing. It's a great program. My mother moved to a active adult community and she promised she wasn't getting involved in anything. And then she turned out getting involved with everything. Now she has all these friends. She's got a life more than I do for sure. She's been all over the place. But I think it's not so much, just them taking the classes. They're meeting, people in the neighborhood and people they have things in common with that they most likely probably wouldn't even see. So keep up the good work. It's always so depressing when you always hear people cutting art programs and fun programs and things for mental health, good mental health. So congratulations and keep going. Thank you.
Yes, no, we think definitely the city of West Hollywood has been funding it and giving us enough funds to really provide this robust programming. So it's keeping Alex and Marina busy, trying to find great, exciting programming.
If I may add, very busy.
Yes.
Okay, thank you all very much. Good presentation, a lot of good information. And we will move to the next item on the agenda. It seems that I've managed to misplace it. Here we are. We're going to go to new business, item B, the post-exposure prophylactics PEP services. And I think I'm going to hand that off to Derek right off the bat.
Yes, thank you very much. Hello, commissioners again. Hopefully I don't have technical issues like I did last time, but I'm going to give a brief intro and then hand it over to the Center and Men's Health Foundation for their presentation. So post-exposure prophylaxis, PEP, is the practice of starting a month-long course of anti-HIV medications within 72 hours of possible exposure. And that's in order to prevent HIV. PEP consists of 2 to 3 medications that are prescribed by a medical provider, and the provider determines the treatment based on how the person was exposed. Pre-exposure prophylaxis, PrEP, is a HIV prevention method in which people take ongoing medication to reduce their risk of getting exposed to HIV. So PrEP is ongoing. An emergency PEP is for a limited period of time. And for this item, we'll be focusing solely on emergency PEP. So the LGBT Center and Men's Health Foundation provide PEP and PrEP services to West Hollywood community members. Men's Health is contracted with the city to provide PrEP and PEP services, and the center provides HIV and STD testing and treatment services. So although the center's not contracted to provide PEP services, community members can still access PEP services at the center. So from March 2020 to March 2021, the center provided PEP to 27 community members. And from October 1st, 2020 through June 30th, 2021, Men's Health Foundation has provided PEP to 4 West Hollywood community members. I do want to mention also within that same time frame, Men's Health Foundation provided ongoing PrEP services to 414 West Hollywood community members. One of the outcome objectives for Men's Health Foundation for that contract is for at least 80% of people who use that limited one-time use PEP, that they are converted into ongoing PrEP users. So Men's Health Foundation has been very successful over the past 5 years. They've met that goal since I've begun monitoring that contract. So I'm going to pass this over first to Jeffrey Rodriguez from the center to give his presentation, and then to Brian Rogers from Men's Health Foundation to do his portion. So whenever you're ready, Jeffrey.
Hi, everyone. I'll try to make this pretty brief. So we, like Derek said, we do PEP at our both of our locations, Hollywood and West Hollywood. It is treated as an emergency situation. So we triage a patient that calls and says they've been exposed, and then we make sure that they qualify for PEP, and then we actually bring them in, usually the same day, usually within a couple of hours. It is very imperative that they get the medication as fast as possible. So that is what we're doing. It has been, so the numbers I'm reporting are not directly what are according to West Hollywood residents. This is just what we're seeing on our overall. So let me show you what what the trend is usually.
I can share it. Oh, you can share. Okay. There you go.
So I'm not sure if you can see all of that. There, that's a little bit better. So this is the course of June 20th through June 21. And if you see how PEP is being utilized or how people are requesting it, you can kind of almost see what's actually happening in the community around COVID. Around, if you think about when we were allowed to come back out, or what people were doing or what businesses were doing. I think it's very interesting that as July 20th, June 20th of 2020, we had a huge increase in PEP again. And then it started to die down again, died down really low, December 20th, 21, February, January, February. Those numbers were still pretty high, even though we're supposed to be on lockdown. I don't think people were wanting to go fully into lockdown mode again. But as you can see, they're kind of all over the place a little bit, but they stay readily into the 30 range. And so we are seeing a lot of PEP. I mean, I know you guys were having a lot of conversation around HIV. Around HIV PEP PrEP data, a lot of it has to do with what is happening, obviously, in the community around COVID and the guidelines that are happening. So people who are not able to get into care or fallen out of care, lost their job, insurance, there's a lot of reasons why people who are on PrEP, fell out of PrEP, new people starting to get on PEP because they heard of it and need it. But there's just, it's kind of, we just live in a very uncertain time. So we're just really happy that we can do this service and that we're here to do this. And we've been doing a lot of talk about just analyzing all of our trends around all of our sexual health services. And this is one, as you can see, is kind of just all over the place to a certain degree. But this is based on what's happening in the world, really. So that's our PEP data. If you guys have any questions, I'm open for it.
Thank you, Jeffrey. Now we can move on to Brian from Men's Health Foundation.
All right, thank you. Let me get my video. Okay, so if you could go ahead, and I believe I sent you my PowerPoint, Derek. We'll just move through that pretty quickly. So our numbers are much lower, but they kind of reflect a very similar pattern, I believe, from what we're seeing with our friends over at the LGBT Center. So we've been offering PEP services really since PEP has been widely available to the general public. We have access to PEP at both our main office here at 9201 Sunset Boulevard, as well as our new Rapid Results Clinic at 8280 Santa Monica Boulevard next to Hamburger Mary's, and in our Inglewood location, which is currently at 2700 West Manchester, and come November 1st should be relocating at 8601 Broadway. We'll probably have both locations available for a bit there, but the hope is we'll be moving into that new community center to service our Inglewood participants. We have a PrEP and PEP emergency line that is available. I mean, it's right here and I carry it. I don't like to promote that it's 24/7, but it's 24/7. Someone can contact us at whatever time, and I'll get back to them as soon as possible. If someone calls me, at 3:30 in the morning, it might be the following morning or when I wake up the following day to get a hold of them. But we really think, like Jeffrey said, it's imperative that people get their PEP as soon as possible. They do have that 72-hour window to initiate the medication, but the sooner you get on the medication, we know the better and the more effective that treatment's going to be. So we want people not to wait. And so we try to make sure that we're available at all times for that. And this line's been very effective in helping us link a lot of patients during the weekend or sort of off normal office hours. And with the expanded hours of our Rapid Results Clinic, that's been helpful with that as well. So next slide will show some of the numbers that we've had. So from March of 2020 to 2021, we see that we had 18, this is not all West Hollywood patients, but we had 18 total. And some of, I was looking at the LA numbers, and, you know, like there's these dips in December, as well as June, you know, this sort of marks certain areas that were indicative of sort of public panic about the pandemic, very reasonably so. You know, Los Angeles was a really scary place in December in terms of where things were, and in terms of COVID, and people were very much locked down. In June, we didn't have any as well, and that's sort of when the pandemic was first kind of coming about, and people were starting to lockdown measures were starting to happen. So we see some decline there. And of course, it's important to remember that with PEP, this is emergency medication. And the more we educate and learn about HIV treatment as prevention, undetectable status, as well as get people on PrEP, really the less necessary it is for people to be getting on emergency PrEP, particularly as a sort of repeat situation. So from this year to date, or kind of moving forward from that, and I just started with the Men's Health Foundation in May. And so more recent numbers we have, if you go to the next slide, we just had 3 this last month. We actually just had a PEP visitor today that's included on this number. But I can say in terms of transitioning from PEP to PrEP, since May, you know, we have a follow-up 30 days after to see how the adherence went with their PEP regimen. And also, this is our opportunity to get people transitioned onto PrEP. And I can say, since I've started, there's really 3 patients who've been able to see that follow-up who aren't currently on their PEP regimen. And 2 of them have successfully transitioned, and 1 was actually a low-risk patient who had a occupational exposure. So it wasn't something that was a regular incident. It was completely kind of an accident exposure at work. All right, and so the big thing that we aim to really is just to promote and continue letting people know that this is a service, what PEP is. We've seen a pretty big or a noticeable increase with our Rapid Results Clinic next to Hamburger Mary's on Santa Monica Boulevard. People can walk in and be aware that this is a service. I know from just a history of working in STI clinics and HIV services that a lot of folks will come in, you know, just wanting to get tested. Hey, I had something happen last night, or I'm concerned about an encounter that I had in the last 72 hours, or and that's a great opportunity and education that we can provide and get people set up right then and there on their PEP. So that's been really helpful. The extended hours of being open till 8 during the week and having weekend hours during Saturday has also been really helpful. So we can get people linked with a provider and set up on their medication quick and seamlessly, and as soon as possible for those patients. And the big thing in addition is just advertising. So right now we have some radio spots. We provide advertising on social media, all the major ones. We just got some new bus bench ads approved that are going to be live soon. So previously we've had some specifically for PrEP, and now there's going to be advertising for both PrEP and PEP. Ultimately, these bring you to our website, which very much promote both avenues. And we're also advertising on various hookup apps. Specifically, we're on Scruff and Jacked. And we also have advertising in Gold's Gym. So we're really trying to target various aspects of the community and make sure that people are aware that we have these services available. And that is it for me. So I'm happy to hear any questions about that.
Yes, commissioners, we're open for questions.
All right, Commissioner Byers.
Thank you for this presentation, and forgive any ignorance if this has been addressed in some other fashion, but I understand that these PrEP and PEP are both now available over the counter in California with new law that was passed in 2019. Is that correct? So I saw that the data started in 2020 or March 2020. So I'm just curious for my own edification, how, have you seen a big drop off in people coming to you because it's now available over the counter? I know, it's different type of service delivery, but just curious about how many folks you see access these services this way versus knowing that it's now available over the counter.
I mean, I can go first. We haven't really seen a drop off yet. Not quite sure how many pharmacists, because it's a whole training process, and how many pharmacists have actually signed up for this. And so, yeah, so there are some guidelines and things that I'm not quite sure if the pharmacists have actually gotten into to actually really start it. So as you can see from our numbers, we have not seen anything drop off actually. So yeah, so at this point we haven't seen anything.
Yeah, likewise, I've heard that information, but I actually can't think anecdotally of any patients that we've had here who have gone that route, or I haven't really heard of any stories of people accessing PrEP or PEP over the counter in that way.
Any other hands? Commissioner Sanders.
Thanks, Brian and Jeffrey, for joining us. I do share your views that access to PrEP is a medical emergency. So just as being part of this commission, I just always want to ensure, as we've done so much great work around PrEP and its adoption, that in times of crisis that PEP doesn't get left out. I just also, with access through a pharmacy, it's also a question of coverage and the cost of PEP versus PrEP. And so most insurers now, Kaiser and all of them, will cover PrEP. You can get out with PrEP for free, but PEP is still an out-of-pocket expense that ranges for many places for $3,000 to $5,000. So that's, of course, a big barrier. And I know everyone works with Gilead to get a relief grant, but sometimes that can get complicated if you do it before or after. And as you said, time is of the essence. So I do appreciate you coming in and helping us understand everything tonight. And Brian, from your presentation, I think the new location on Santa Monica Boulevard by City Hall and the outreach will be helpful. So I just always want to ensure that people have a safe and friendly place that they can go to get PEP when they're in crisis.
Mm-hmm.
Thank you, Commissioner Shandrick. Commissioner Melton.
$3,000 to $5,000 for how much? I mean, how much? I don't know how it's sold, but $3,000 to $5,000 would cover what? How much?
It's
1 month. It's a month. It's only a 28-day regimen for 2 drugs. So 2 HIV drugs. So it can be very expensive, but I think, like Commissioner Sanders said, there are patient assistance programs for like Gilead and ViiV, who are the drug bankers, who actually make it free and affordable for them, mostly free. And when we're working with those patient assistance programs, when we let them know this is a PEP situation, the approval is immediate. There's not a lot of paperwork involved. It's very easy to get processed through, and we've been doing it for a very long time, so we have our contacts, so it's pretty easy to process. But yeah, so I think where that does make a difference is when we're talking about if a patient were to walk into a pharmacy, they may not get the same customer service level and just be told, well, do you have insurance? No. Okay, well, this is what it's going to cost you, rather than try to work with them to get on a patient assistance program, because it does take time. And so there are different things where I'm not quite sure where the pharmacy's customer service level is going to be with a patient like this. I'm hoping some of the local drugstores, like, our local pharmacies in West Hollywood, would probably get on this process, just because it is a slight barrier to come to us, with the hours or with the, just having to see a provider, because a pharmacist can prescribe. I'm all about low barrier. So if there are local pharmacies that are willing to do that, that would be amazing. And as you can see, our numbers, we are more than happy to share some of our lovely clients with anybody.
Thank you. Thanks.
Anyone else? Commissioner Darvish, really? You're going to sit this one out?
I don't have any question. I just think that was Commissioner Chandrik that mentioned Gilead, and that's a shame that they don't cover someone that's already been exposed or has to be treated. They do. I think they cover for prevention. So PrEP is covered. That's what I heard, I believe.
They will cover PEP also. So they will cover an emergency situation.
Just for 28 days or one?
Mm-hmm. Yeah, they'll do the 28 days. And then it does make it, I think like Brian was saying, when you're transitioning a patient from a PEP to PrEP patient, it does make that process even a lot easier.
Right.
So I do want to mention something that we haven't really mentioned is the state program, the PrEP AP, the PrEP assistance program. If you're on PrEP AP and you fall off, like not taking your PrEP consistently and then need PEP AP will actually pay for those visits also. So, so there are a lot of different, I think the state of California has done an amazing job in supporting the community and the HIV community and prevention around making sure that there are resources there for clients and patients who need prevention around HIV. So these are some of them. We utilize anything and everything to help make sure that there is no cost to a client. And at the end of the day, I will tell you that the center, we work very well with all the patient assistance programs, but like labs and office visits and stuff like that, we will take care of, especially for an emergency situation.
Yeah, I did have a comment about, I think you mentioned more outreach and signs that you will put at the bus stops, I think on the bench. I think that's critical. There's a lot of the population may not know, as you mentioned, you go to a pharmacy, they don't even take a second, they're so busy to even talk to you. So I can't imagine an individual going there and them taking the time. I mean, they're great people, don't take me wrong, and they're very passionate and caring. It's just that the way the model works, they're so busy and they just don't have the infrastructure, and that's good that y'all are there to support, but the more outreach, the better. And to be honest with you, I've never seen any, just walking down Santa Monica, maybe I don't look enough. If y'all have advertisement already on any sort of kind of visuals, at least for in West Hollywood, you mentioned you have some, but you're adding to it.
Yeah, so we do have some bus bench ads already. There's some advertisement, of course, on the actual building for the Rapid Results Clinic on Santa Monica as well. But yeah, just trying to increase that and particularly make it more focused to let people know. I think a lot of people do know about PrEP who might not even know about PEP. So we're just sort of making sure that that level of information is out there, that people know that there's an emergency avenue for them to explore.
Yeah, great job.
Thank you. Commissioner Freiberg, did I see your hand up there or did you change your mind? Maybe something different. Okay. Gentlemen, thank you very much for the report. Very nicely done.
Thank you.
Mary, did you want to ask? No? Okay. It's always a pleasure to see you, Jeffrey. Been around a while, doing very good work. And the same to you, Brian. Welcome. And good luck in your future. All right.
Thank you.
Eric, are you, you're waving? Okay. All this going on, it confuses me a bit. All right, so staying with the agenda, we have no consent item. And so we will move to items from staff, which I'm going to give to Dave.
So good evening once again, commissioners. I'm going to provide the monthly update on emergency services provided in response to COVID-19. I'm going to start out with the rental assistance programs. The information that I'm giving you for NCJW's emergency COVID-19 rental assistance is as of August 6th, so last Friday. As of August 6th, NCJW has, as you may recall, there's an opportunity for community members to access five grants. So as of last Friday, they have provided to 478 individuals a first grant, a second grant to 429, a third grant to 379, fourth grant to 210, and a fifth to 89. The total amount distributed in rental assistance is $1,318,450.22. For the Alliance for Housing and Healing, for their Aging in Place COVID-19 rental assistance program, this information is as of July 22nd. They also provide the opportunity for 5 accesses to grants. As of July 22nd, they had provided 102 first grants, 81 second, 57 third, 41 fourth, and 29 fifth, for a total of 305 grants and a total of $239,108.14. For legal services, as you know, we have entered, this is actually the third iteration of BETCEDIC's Eviction Prevention and Defense Services Program. As of August 6th, 21, last Friday, they had conducted intakes with a total of 141 West Hollywood community members, and of those, they have resolved 74 cases. I wanted to mention, even though this doesn't sit in social services, but as hopefully you know, the city dedicated emergency funding to the Coalition for Economic Survival. And this contract was brought on really to kind of complement BETCEDIC services and to provide additional resources for community members, legal resources, with regard to the eviction moratorium, which is scheduled to lift in the state at the end of September, and then just legal services in general regarding tenants' rights. So, as I said, it was meant to provide additional services for BETCEDIC, and I wanted to give a little snapshot. I have they started the contract March 15th. I have their July program report in front of me. As I think I said, this sits in our rent stabilization and housing division. They oversee this contract. So in July, the Coalition for Economic Survival conducted virtually 6 weekly legal clinics. I guess it's a little bit more than weekly if it's for the month of July. There were 34 new and unduplicated West Hollywood community members that attended those clinics. In addition, they provided 3 educational workshop sessions specifically about the eviction moratorium, and they conducted proactive outreach regarding the eviction moratorium to 120 new and unduplicated West Hollywood community members. So that's the update on emergency services. Provided if there's any questions regarding that, I would be happy to answer. And if not, Commissioner Palmieri.
I'm just looking at the number. Can you hear me?
Yes.
Just looking at the numbers for NCJW as opposed to AHH, but there, of course, NCJW is a lot larger. But if you look at the pattern, the first grant is the largest in the information that you have. So another almost 500 people went in, and into AHH another 102 people went in. It declines as the grants go on, but it seems I've just been doing a lot of research on this, and I think I spoke to you about this in the afternoon, David. It doesn't seem like this is something that is settled at this point. And I was just wondering, like, what is, if you have an opinion other than just the numbers?
An opinion on?
Do you think that people are still going to be needing this service? Do you think the service is winding down? What is, because I read numbers that are scary almost, and I'm just wondering what your thoughts are.
We've had these conversations, so what I'm sharing is more than just my thoughts. We've had this conversation. We meet, Leslie and Derek, who oversee these contracts. We meet with the agency staff of the Alliance and NCJW fairly frequently. And we met probably a week before last and had this conversation, Commissioner Palmieri, what's next? There is still funding available. I'm sorry, I don't have it right in front of me, but both agencies have a considerable amount of emergency funds available. In fact, we have not provided NCJW. We went to council in December and took an estimate of what would be needed to get these programs through September. We wanted to tie it in with the social services contracts. So at that time, we asked for additional funding for NCJW. There is $150,000 that was allocated to council that has not been provided to NCJW. They haven't had a need to access it. They have about, Leslie can counter me, they have about $110,000 left from the previous allocation, and then there's 150 waiting. The Alliance, I believe, has about 80,000 left from their last allocation. We will go to the council in September, along with social services contract renewals. They'll come to you first at your next meeting. We'll go with recommendations for these programs to continue after September. I believe from our conversation with the providers, it's a consensus in thought that once the eviction moratorium lifts, there's going to be, potentially a huge surge in need for assistance. As we know, folks in need should be applying to the state's program, the California Rent Relief Program, but there is a tighter income eligibility for the state program than we have. We stayed with these programs, we stayed with the federal guidelines. So up to $75,000 annual income for an individual. And I believe, Leslie, it's like $150,000 for a family. The state program goes with the AMI. And so for West Hollywood community members, for an individual, the cutoff is $66,000. So not as many folks are eligible for the state as they are for us. But with that said, the push is for everyone to apply for the state rent relief program. That will forgive all of your back rent. I mean, it used to be an 80-20 split. That state would cover 80% of your back rent if your landlord agreed to forgive 20%. They took that out. The state will cover 100% of your back rent, plus look at providing future months' rent. So everybody should be applying for that. And we have been pushing that, and the agencies push that when they get applicants. So with that said, this also ties in with that CES. I don't think we can't have enough resources when that eviction moratorium lifts. That was, the big justification for CES coming on. That SEDEC's we're going to need to get, CES's role is really to get the information out, to have these legal clinics so people know. And then our recommendation will be to continue these programs. I don't know, honestly, right now, if we'll ask for additional funding. We'll have a better sense when I make this report in September to you. But we see these programs continuing after the eviction moratorium lifts.
So like when I asked you this afternoon, in doing research and then seeing on the news, when the rent, the moratorium is lifted on rent, they predicted 1.5 million folks were going to be homeless. And, I know that we're being proactive in not having that happen. So I was just wondering what your thought was, being in the position that you're in, how we prevent that from happening to our folks.
Well, really, it's that I'm repeating myself.
No, you answered already.
Yeah, folks have to apply for that rent relief.
Yeah, but no, you answered in that you want the programs to continue.
Yes.
It's just it's a very I know it's a very difficult time for a lot of services, but it's sort of like a spiral. Like once this moratorium's up, so many more services will be needed, including legal, like you said.
It's really hard to predict, honestly. Yeah. So folks need to reach out for all the services that are available And, we're doing what we can to have, services in place.
Yeah. Thanks.
Thank you. Any other questions? So the other point that I had on there, I put the code of conduct, and as soon as I did that, the city clerk gave me a call, and the city clerk's office had planned on providing trainings to all of the boards and commissions on the code of conduct for elected officials, elected and appointed officials. So Melissa Crowder, the city clerk, asked if she could make that presentation to the commission, have that training to the Human Services Commission in September. So we will hold off, and she will be bringing that. I'll, be in conversation. Part of why we wanted to do this, not only to review for new members and answer questions, but also to look at it through the lens of the funding process. Because as commissioners who've gone through know, it really, focuses and guides a lot of the aspects of that process as well. So I'll meet with Melissa and kind of give that frame so she can include it and highlight sections that pertain to that. But that will happen in September. So that's my update. I don't know, Derek may have gone. I think Leslie, anything further from staff? That's our report.
Yeah, nothing from me. I think I'll just add that in the Q3 program report from NCJW, they gave a little summary of people who were helped by rental assistance, and not one person has fallen out of housing who's received rental assistance from that program. The vast majority have remained in the apartments that they were living in when they applied for assistance, and with a few other examples of people moving, and some still moving in West Hollywood, but nobody has fallen out of housing. And we were pleased to see that. And I'm sure that is a similar situation with Alliance.
Nice news. I like that. All right, commissioners. Public comment. Jenny, do we have anyone?
Don't have anyone at this time.
Okay, thank you. So we'll go to items from the commissioners. So, see, I hate to be the pick because it makes me feel like a school teacher. So I'll start with Barbara Meltzer. Yeah, there.
Well, I have a nice thing that happened. As those of you, new people don't know, I represent West Hollywood or the Commission on the Motion Picture and Television Fund Social Isolation and Loneliness Coalition. And I had to practice that to be able to really say that well. And it is social isolation and loneliness is a very huge issue for me. And so Maureen Feldman, as you know, she has done some keynotes for us. She is putting a small steering committee together to take the coalition to the next step, and she has asked me to serve on it. So I'm really excited about that, and you'll be hearing more about social isolation and loneliness. That's all I have.
All right, thank you, Barbara. Anyone else want to volunteer? No one else has anything? Vice Chair Palmieri.
Thank you very much. I just have a few things. We have been meeting on whether or not to have Boom. A couple of council members wanted us to actually have it physically. And, you know, it all sounded well and good in a phone call and a text and that. But we got together and the team that puts it together unanimously decided that it needs to be virtual. It's funny because at that meeting, 2 people are vaxxed and 2 days later had COVID. I didn't get it I immediately when I got tested, I didn't get it, but I don't think that this is any time to be putting hundreds of people together. That being said, we're going to try to do a state-of-the-art virtual Boom, and with as best we can to maybe have people have small house parties and gatherings and watch in. It's new, and like everything else, we'll have to adapt to it. I did want to say again that COVID is still happening, and 4 of my buddies that are vaxxed, 3 of which I was with, have it. One had it really bad, didn't have to go to the hospital, but was very sick and still has no taste or smell after 12 days. The others got through as having bad flu symptoms, but it's not a game. You know, I hate wearing a mask, but I'm just cautious. And I really urge people that might be listening, just wear it when you see crowds or wear it in the store. Just do, you know, be proactive, because I'm finding so many younger friends of mine are getting it. And I just, it's distressing to me. We all have COVID fatigue, all of us. But, you know, I also had HIV fatigue when that hit. And, you know, we did what we could to stay around and stay well. So, you know, this is 1 year. And I think that if people are listening, that I think it's a good thing to reassess and to be as careful as you can. Other than that, I don't have anything. But this was really interesting. A lot of the reports and everything here, this was a really interesting meeting, and I was unusually quiet today, but this is my 4th meeting, so don't think that I wasn't listening to every word that all of you said. And David, thanks so much for your information. I appreciated that.
Thank you, Vice Chair Palmieri. Anyone want to give me a hand? Commissioner Sandrick.
I don't have anything to report. I had been in Pennsylvania for a few weeks helping my mom transition to nursing home in another state. So it was quite a process, especially during the pandemic, but I'm glad I could be there for support, and I'm glad to be home and see all of you tonight at our meeting.
Thank you, Mr. Sandrick. Commissioner Darvish.
Yeah, thank you so much. I wanted to thank Leslie and David for a lot of backgrounds that as a new commissioner, kind of new since March, still new, and the support that all of you provided, those of you that have been a commissioner, you know, from Commissioner Shandrick to Chair Davis to Commissioner Meltzer, that was the first one, reaching out to all of us newbies, and I don't want to miss anyone. Palmieri, Commissioner or Vice Chair Palmieri, all of you have been great support, but I know Leslie's always quiet in the background, and I know a lot of work goes beyond all of this, but David and Leslie, so I wanted to thank you. Also wanted to thank our council for, I think they approved the racial justice conversation with Dr. Robin D'Angelo. I'm sure all of you had to attend it. It was mandatory. I really enjoyed that. I've attended a few at our company, being, you know, a national company, and I was really impressed with the way it was put together and the content. It was very educational, even to me, someone that has been exposed and someone from, you know, raised in a different country and have been targeted when I was younger in New York and Atlanta, that I've shared stories with you. So it was very impressive, and hoping we do more of that, and just as part of our awareness that all of us could, we may know, but we never know when how someone feels, someone that's affected. So the more we can hear and listen, the better. So thank you so much. And lastly, I wanted to comment on Transportation Commission. I've been a liaison to Transportation Commission, but even before that, I've been attending. Due to the accident that I had last August, I've been very engaged with that commission. Great work that they do, and they listen and really focused on residents and their safety. Every agenda item that comes through, they're bringing up how does this affect the residents in West Hollywood. I did bring up to them the use of scooters that are great. We see more of them around the city, and here and there you see some that are blocking the sidewalks or handicap access for no one's fault. Maybe the person does not know what not to do. So I brought it to the Transportation Commission for maybe guidelines to have the companies to educate the customers, or so things like that. So again, wanted to thank that commission for the great work that they do and discussions that they have.
Thank you, Commissioner Darvish. Commissioner Byers or No? Good. Okay. And Commissioner Frederick?
Yes, I have something to say. I just wanted to thank all of our presenters tonight. And since they're not here, I won't go through every single one of them and say thank you. But great information, a lot of good things going on. One thing I did want to bring up, I'm a liaison for the Disability Advisory Board, and board member Nash has always brought up the Palm Avenue crosswalks, and it is a hell of an intersection over there. And there's 2 crosswalks where you're literally taking your life if you cross. Like at one point I went to go check it out. It was during rush hour. I would never, ever cross, over to Palm Avenue and across Palm Avenue. There's just too many things going on. And I don't know if any of you other commissioners are familiar with that intersection with Sunset and Palm Avenue. Yeah. And then Holloway. I mean, it's just a recipe for disaster, and I'm surprised more things don't happen. Thank God they don't. But is there a way that we can get an update if anything's been going on? Because we've been talking about this for a long time on the Disability Advisory Board. And I know they, went over a couple different areas, that they wanted our input. And I was wondering if anything was happening, especially with this one intersection.
You can check in with city staff. I know that I've been to Transportation Commission when they've received some updates on that. So let's check in, and let me see if I can bring you an update under items from staff next month.
And if I may add to that, Commissioner Freiberg, I have been involved with Walter Davis after the accident. So the neighbors, I'm on Larrabee by Cynthia. So Walter has added, or the city has added, 2 crosswalks, one at Cynthia, one at Harriet and Palm. But to your point, that above all of that, right by Holloway and Sunset, that's something I think Walter is looking at. So maybe if you personally reach out to that Transportation Commission, I haven't seen that on the agenda. I can bring that up too as a liaison. But that's a great point. That's very interesting.
But I think the bigger point also is for that there's a senior building over there, and that leaves them immobile. So then they can't go in that direction. I mean, even on a slow day, it is so dangerous. I would not cross there. You can pay me enough to cross there. And I just think, I hope somebody is or has been looking into this, because I know it's been talked about for a long time. And that's it.
Thank you, everyone. I would also like to just state that the presentation for the like racism and white, on all of the issues that she brought up was an incredibly good presentation. That I have a problem with the word mandatory. Always had a problem with the word mandatory. There must be a better way to get us there without having to threaten us. But other than that, it was well worth the time. It's opened up a couple of great dialogues with friends of mine, so it's very interesting. So I'm thankful for that. I agree. Thank you to whomever brought that forward. And other than that, I'm going to adjourn the meeting. Thank you all very much.
Good night, everyone.
Good night, everyone.
Take care.